Mr. Speaker, in vitro fertilization is now being used in up to 2% of pregnancies. It is a valid and legitimate health expense, and it's now being covered under Medicare in Quebec and will be in 2 weeks in Ontario. And yet this current NDP government doesn't treat it that way. They don't include in vitro fertilization under Medicare. I asked the Premier, will the NDP adopt the Liberal position that in vitro fertilization should be covered under Medicare in Manitoba?
Mr. Speaker, we brought in a fertility tax credit in Manitoba to support families that want to have more children when they have challenges to do that and they need medical assistance in that regard. We made it a commitment in our throne speech to improve the ability to support families that are seeking treatment with respect to fertility. And I just have to say that the member's approach that has been put on the record is for one single treatment for a very narrow scope of service in Manitoba. The existing fertility tax credit that we have in Manitoba covers much more than that. It covers a wider gamut of services. It pays out more to families that need that support, and we will look at ways to make that even better. But the member's approach has even been criticized by the community as being inadequate, too little, too early, and not sufficient to help families with the full needs that they have when they're seeking fertility support for their futures, Mr. Speaker.
Mr. Speaker, in vitro fertilization should be covered under Medicare because it covers all and not just a few. Mr. Speaker, the Premier argues that his fertility treatment tax credit is the answer, but in fact that only helps the 15% of those who can afford the upfront costs. It's still less than supportive treatment under Medicare. The tax credit indeed is highly income biased. Why is the Premier using a highly income discriminatory approach like a tax credit for a procedure that should be available to all Manitoba families?
Mr. Speaker, as I indicated earlier, the approach taken by the member opposite is one that's very narrow and it actually takes away hope from people. They get a little bit of help and then it all disappears, Mr. Speaker. Our credit applies to a wider range of services and provides more generous support. And we've already indicated we're looking at ways to improve that, Mr. Speaker. The member asks for it to be covered under Medicare. I have to say to him the following. Home care is not covered under Medicare, Mr. Speaker. All of those services we're providing in Manitoba are 100% provincial dollars. We'd like to see many more things covered under Medicare. The original promise of Medicare brought forward by the Tommy Douglas government of Saskatchewan was for hospitals, physician services, and then to broaden it beyond that, to provide services in the community, to allow people to live well in their communities for a longer period of time. We need reform in Medicare, no question about it. We look forward to the opportunity to pursue that with the new federal government. We are committed to universally accessible health care. The leaders of the opposition, the leader of the Conservative Party, has said two-tier health care is something we need in Manitoba. We do not believe you should get to the front of the line based on the size of your wallet, Mr. Speaker.
But, Mr. Speaker, tax credits are based in part on the size of your wallet. Mr. Speaker, covering in vitro fertilization under Medicare, as will happen in Ontario and is happening in Quebec, also ensures a high-quality procedure with a single embryo. It eliminates the risks of multiple births, which is a larger expense to the healthcare system. Why, after 16 years, does the NDP not see the sense, the wisdom in covering in vitro fertilization under Medicare in Manitoba?
Speaker, the tax credit in Manitoba relates to the amount that you spend. It gives you more back than anything that the Liberals are offering, Mr. Speaker. I wish the member would acknowledge that. He's doing too little for too narrow a range of services. We're making more resources available for a broader range of services. We think we can improve upon that, and we will improve on that, Mr. Speaker. And I'm very glad to see that the member's finally speaking about Medicare. That is a system that needs to be protected in this country. It needs to be enhanced. It needs to be strengthened. We have no pharmacare covered under Medicare in this country. In Manitoba, we have a universal system available to all Manitobans based on their ability to pay, Mr. Speaker. We have a fertility tax credit which relates to the actual costs that you incur. Their approach is too narrow, it's too little, and it's too late, Mr. Speaker. Our approach deals with more Manitobans, covers more Manitobans, not only for that, but for home care and for pharmacare. And we look forward to the opportunity to take universal, accessible, and affordable Medicare to another stage of development all across the country of Canada.